This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.
Welcome back to Gramercy Park Integrative Medicine. That's right. We are here with the founder and doctor herself, Dr. Dladla, joining us here today, live from her New York City office. And again, she's working with people, though, all over when it comes to the point where conventional medicine sometimes maybe doesn't do it all. We're talking more of a holistic approach and, of course, about their pillars of approach. We have so much to get to. And again, if you haven't met her yet or talked or listened to any of our shows or seen her, you're in for a treat because there's so many different modalities that she's here to help so many people with. Welcome back today. How are you?
Good. How are you?
I'm doing fantastic, sweetheart. So for
Yes.
those that may not know, all you do from helping people with heart disease, gut health, weight loss, hormone replacement therapy. I mean, we don't have a whole show to get to this, but give us a little overview of the type of work that you're doing.
Oh, absolutely. So I'm an internist by training. I've been a doctor for over 20 years, and my clinic is an integrative medical practice. So we combine holistic, integrative, alternative services with conventional medicine when necessary. So I do like a wide range of services. So we do hormone treatment, bioidentical hormones. We do that in the form of pellets, creams, injections for both men and women. We also focus on weight loss and body contouring. We have the M-Sculpt machine, which has been very popular this summer right now.
I've been doing that. I've done it 3 times this summer myself. Yes.
Right? It's great. It's great. 20,000 contractions, right? In 20 minutes. So we also work in general wellness in terms of gut health and really trying to optimize your health wherever you are. A lot of our programs kind of weave into our longevity kind of outlook. And the whole idea is not only to increase your lifespan, but to also increase your health span. So, one of the programs I wanted to kind of talk to you about today is our heart health program. So, I would say our program is quite unique because this is a yearly program. The first year is kind of quite intensive. We do a lot of evaluations to see where you are in terms of your cardiac health. So we're working with people who have no cardiac disease, but may be at risk. We're also working with people who actually have had some kind of cardiac diagnosis, but not yet have had a heart attack or a stroke. And we work to prevent that from occurring. We also work with people who've already had those events, and we want to ensure it does not happen again. So part of our program, we look at very, very in-depth blood markers, not just your regular lipid panel, but more looking at inflammatory markers that may put you at heightened risk. We also look at genetic markers. There are certain genetic tests that are associated with a higher risk of heart attack and stroke. We optimize your diet. We individualize it based on you. We talk a lot about exercise and really, very importantly, stress reduction.
Yeah.
So it's a really comprehensive program. We also recommend certain kinds of imaging where we can really diagnose, but also follow you to make sure things are staying stable.
Mm-hmm.
So for anyone who has a family history, who has high blood pressure, diabetes, or even like blood sugar that's not completely regulated, it's a really good idea to come and speak with us and get a consult so we can really give you the full view of this program, which is very, very successful in preventing and also preventing secondary events for people.
And when you're speaking of secondary events, could you just elaborate a little bit about that?
Oh, sure.
Like,
So secondary events meaning that you've already, unfortunately, had a heart attack or a stroke,
mhm.
maybe even a silent heart attack. right? You go to your doctor and they do an EKG and they say, oh, there's something happened to your heart. And you're like, oh, I didn't know that. I didn't have any symptoms.
Yeah.
Things like that, we kind of look deeper into and make sure.
Now, for example, people that are dealing with,
Multiple modalities.
gotcha. Oh, sorry, I cut
Yeah.
you off. Okay, we had a little
Oh,
bit of a
that's
pause.
okay.
That's fine, it's fine. Okay, thank you so
Yeah.
much. All right, continue.
Yes. So we use multiple modalities, including, nutraceuticals, supplements, but also medication when indicated. So, of course, we go with like patient's choice and personal preference, but we do offer you like best practices from the
Hmm.
from the standpoint of prevention, because many of us are, we're just basically waiting until something happens, and our focus is not to get you to that point where you're going to the doctor because you have chest pain. And it's much more common heart disease than people really are aware of. It's the number one killer of humans and particularly women. So it's something that we have to think about, and even a little bit earlier than we may suspect.
And, some of the signs of these things, it's funny. I was watching a TV show last night and there was someone flying a plane and he had the pain in his left arm, just talking about heart, and right. And then the person in the coat in the seat's trying to get them the aspirin, trying to put something under their tongue. And it's like, these things happen and there are warning signs, right? Let me just ask you about this because,
Yeah,
um, some people don't even know they have heart disease and something like this happens. But and you're flying a plane or you're out and you have a heart attack or something. But you're telling me that there's ways that we could also, can I say prevent, or actually, do the tests ahead of time to know what we're in for, to start working on this so maybe it doesn't happen, right? It's like
exactly.
preventative, not preventative aging. You do that too.
Yeah.
But preventative medicine in a sense. Thank you. Thank you. Thank you.
Yes, exactly. Because often, you're not going to necessarily have signs and symptoms that
Yep.
you do have underlying heart disease unless you do the proper like diagnostic imaging. So if you
Got it.
don't do that, there's no way. So you can easily go to your doctor and be told everything is fine, and then something happened the minute you step out the door. And that's because it was basically undiagnosed. And you can be somebody with normal cholesterol, no high blood pressure. You can be actually an athlete, who's super fit, and still be at risk. So it's really important to do that preliminary investigation to kind of see what is going on with your heart, with your arteries. There are some people who have like high cholesterol, right? And once you do the diagnostic test to see the condition of their arteries, everything is normal. So everything has to be treated individually, like in a personalized manner, but it's really important to do a lot of prevention, going as natural as possible, but then, like I mentioned, utilizing medication if indicated and if needed.
Got it. And, this is amazing. We can find some of the root causes of this, right? And, a lot of the things you're doing ahead of time. Would it be that genetic testing? What are some of the things that you could do?
Yes. So first, I think it's important to say that the main cause of heart disease is oxidative stress. And basically, that's a situation where you have these kind of reactive or like these hyperactive molecules that can actually harm your existing cholesterol.
Okay.
And when it goes through this process, it kind of creates an environment where now you have the potential to build up this plaque. And that's what we don't want to see. Once your artery is breached, it's like having a little cut. And now you have cholesterol going through the vessel. Now it's getting stuck to that
Yep.
area that's inflamed. And now this is like the whole setup, for building up plaque and having an event. So oxidative stress is one of the number one causes of heart disease. And this is all related to inflammation. So one of the things that we do is if you do have plaque in your arteries, we do everything we can to decrease the inflammation in your body.
Yeah.
So we are kind of preventing this environment for something to occur. And there are like numerous things we do. So one thing about, for example, the genetic testing, this can look at certain markers in your blood. And there are some people who have normal cholesterol, but then have these markers that do make them an increased risk for having some kind of heart event. So this is not like your usual testing, your routine testing. So when you have this information, it really helps you to be more proactive in how you're going to address this risk. The risk does not mean it has to turn into a reality. It does not have to manifest, but it just makes it more likely. And there are things that you can do to prevent that risk. One of the things that we also like to do is like yearly imaging and monitoring in certain cases, just to make sure that our treatments are working and that things are not going in the opposite direction. So it's really critical because normally people are going to the cardiologist after they've had something happen or they have uncontrolled blood pressure, something of that sort. But there's a lot we can do to create an environment in your body where you don't have to, succumb to these situations, these issues.
I love hearing that because, yeah, most of us don't do anything about it till it's too late when you're experiencing pain and you're in the hospital, on the way to the hospital, and, praying to God that you can make it. I mean, this is so,
Exactly.
I just wish more people took advantage of this preventative type of health care. And I'm just so glad that people like you, and, as you've had a great career as an internist, correct? Was that your
Yes,
and I
internally.
mean, which is amazing. Medicine is its place and it's amazing. And there's still more to medicine on this holistic side. And to have the benefits of both is just so beautiful. And I love that, you're stressing these types of the importance of some of the basic things that we could do to start helping ourselves.
Yes, exactly. So when we talk about basic in terms of diet, the Mediterranean diet has been shown to be very effective in decreasing inflammation. When a person has heart disease, there's also a very particular pathway, unfortunately, that gets set off. And this pathway has to be blocked. And through lifestyle supplements, medication, we can kind of block this pathway. Um, but in terms of everyday things that we can do, one is diet, right? We can eat more berries, right?
Mm-hmm.
Um, more antioxidants in our diet, which are the berries, greens. We also, can increase our omega 3s, salmon, sardines. All of these things are very helpful to kind of build up like your good cholesterol. Um, Another really important thing is exercise. But I want to say when you over exercise, you also can increase your risk for heart disease. So that's something a lot of people don't
Really?
know.
I never heard
Yeah,
of that
so
until today.
yeah, I've had really, really healthy patients exercise very intensely, have a really strict diet, and still they have inflammation in their body. So you
Yeah.
want to make sure you do the right amount of exercise for your particular body and your metabolism. And that's some of the things that we tweak and we discuss when you enter into our program. Um, I think also a really, really, really critical thing, obviously, is stress, because stress can actually increase the oxidative stress in your body. And I think, like we talked about before, with stress, all of us have stress. So your body does have to learn a resilience to that stress. But when you're staying in that chronic fight or flight, stressed out, miserable state, where you're always on edge and on alert, your body never has the time to recover. And all of those hormones, neurotransmitters are being released that are just increasing this oxidative stress.
Yeah.
So whatever we're doing in terms of heart health, it really has to be a multidisciplinary approach. You can't just look at one thing. It's many things at once that have to come together.
Got it.
Um, we also talked about in the past gut health. So gut health also is a big thing because not only is gut health important for many, many things, but it's also specifically important for heart disease. So when we have a really imbalanced gut or a leaky gut, it can accelerate the inflammation in our body to create cardiovascular disease.
Okay.
So part of our approach is to attack all of these things and see kind of where the weaknesses are and try to eliminate them and do as much as possible to create the best environment in your body so your body can heal.
Well, you've been doing this for quite some time, and I know you have some great stories about some of the people you've been helping. In addition to, us learning, about what you're doing, could you share a story or two of someone that you've helped go through this process and the importance of it because of, what you discovered during this, in a sense, pre-imaging and, initiative, I should say, findings?
Yeah, exactly. So I have a patient who really, first of all, does not like to see doctors of any kind, and has been in general pretty healthy feeling. But when he came for an evaluation, we started looking at various things like his sleep. So his sleep was very dysregulated. And we know when your circadian rhythm is off, when your sleep is off, that also can be a lot of pressure on your heart, particularly if you have like a sleep apnea. So this person we found out did. Um, he had always been feeling fine. He ate healthy. So, he really was kind of didn't really want to do a lot of initial investigation. But I say it's really, really important because you're going to be
Yeah.
shocked at what you find. So we did. And when he had that test, that they basically told him at the test, you probably need to go straight to the hospital and get a intervention. He was like, no, he was freaked out, understandably so. So he came back to me. We reviewed the results, and I put him in this program. And this program has helped him significantly. When we repeated, some of these diagnostic testings, we see that that plaque that he has is slightly less. So this is excellent and it's stable. But we went through all the steps. So we went and we looked at different markers. He told me if he has a family history, most of his, like his mom, his dad, they all died of heart attack and stroke. When we look
Hmm.
into his markers, we see he does have all these high risk factors. So now we created this whole program using various supplements, focusing a lot on getting his sleep back in order. Um, I did have to put him on medication. This is one person who didn't want it, but once we actually saw what was going on, in his case, it was indicated. So we did a combination of events. We did a lot about stress reduction, meditation, deep breathing, grounding, all of these things. And now he's doing pretty well. And thus far, he does not have to go for a particular cardiac intervention.
Wow.
So, so
Wow, wow,
it's really
wow.
exciting. Yeah.
I love this. I mean,
Yeah.
this is so these are the stories that mean so much, and I hope people are understanding this, what an impact this can make. Thank you. What else did you want to
Yeah, of
share?
course. So I just wanted to share that, this program is available, but I also wanted to just mention that one of the things we're focusing on is having these like comprehensive functional assessments
Mm-hmm.
in the clinic. And we're doing this virtually. So I really recommend this to someone who necessarily doesn't want to come to the doctor's office, but really wants to get a full, thorough assessment. And one of the things we do is we do look at certain markers of cardiac health, but we also look at GI health. We look at dietary
Mm-hmm.
sensitivities. We do all that testing before you even meet with me. And then we have a very, very thorough consult after all that testing is done. I have all the information. I create a program, a suggested program for you to follow. And it's really great because it's like, my experience in internal medicine, people just come for their physicals,
Yep.
right? They get their blood work done. Someone listens, does a quick physical exam. But here we're really going deep to see what is really going on in your system that cannot be detected just through doing a simple physical. So it's really, really helpful because the minute you sit down with me, you have a whole wealth of information and a program that you can go with for years to come.
Got it. Well, and you've been doing this for so many years, and I love hearing these positive, amazing stories. Have you ever done anything on like you that like, preventative tests and discovered something's wrong with you or a close family member? Like, oh my gosh, like we should all be getting genetic testing and imaging, right?
Yes. So what happened with me? I before I had my own practice, I used to work in this executive physical program where we would do day-long physicals with people. So when I came into that position, they said, "Oh, why don't you just try and do all the testing yourself
Yeah.
to see where you're at?" So my cholesterol always been fine. I didn't have any diabetes, nothing. When I did that test, I discovered I do have coronary artery disease. I did have plaque in my, and I was
Wow.
absolutely floored. This was before my 50s. I'm in my 50s now. This is before that. I was absolutely shocked, and it was a really great wake up call because now all of my kind of focus is on the cardiac health. That's where I'm kind of orienting and emphasizing. So the supplements, the diet, the lifestyle, all of those things are geared towards really what was affecting me. And I was someone, like I said, who had no symptoms, had normal physicals every year. But thank God I have this program, so I put myself in my own program.
Wow.
So,
Oh my goodness. See, I love it. Thank you for sharing all of this. Holy cow, you
yes.
just never know. Wow. And we still
Mhm.
got 5 more minutes left in the show. What else do you want to make sure, Dr. Law, that we're covering today?
Well, back to our discussion of cardiovascular disease. I mean, I think the symptoms are really something that people should try to alert themselves to, and it's a little bit difficult, particularly with women. Women sometimes have atypical symptoms, and they may just blow it off. But some of the symptoms are really unusual fatigue, which is really, right? That's tough because a lot of us get tired and it can be so many causes of
Mm-hmm.
why we are exhausted. But sometimes this fatigue kind of comes on suddenly and it becomes very debilitating. So that's one of the particular signs. Jaw pain can be a sign for women. Um, you know, I had one patient, a male, who he didn't have any pain, he didn't have any fatigue, but just a weird, what do you call it? A weird sensation where his body just didn't feel right. And he went straight to the hospital, and ended up having stents put in right away.
Mm-hmm.
So I think like being able to be in tune with your body, talking to your body, getting a sense of how you feel and how you function, and really not ignoring things that are really out of the blue is really, really important. Even if you go to your healthcare professional and they tell you, oh, you're fine, if you really feel like something is wrong, it is best to like quickly get that looked at, even maybe in an emergency setting where you can get, imaging very quickly if it comes on very suddenly. So I really emphasize that because a lot of us go through many things. We're stressed and we just can ignore certain symptoms, and then we
Mm-hmm.
can end up in a really catastrophic situation. So listen to your body. Start even daily getting in touch and talking to your body and seeing how you feel and asking like where in my body do I need, where is there inflammation? What do I need to do? So all those things, being in tune, using your intuition with also all these other proactive measures can be life-saving. And you have to be able to be your own advocate for yourself. So,
Oh my goodness. Well, thank you for sharing all this. And let's talk a little
yeah.
bit about the way we can reach out, we can work with you on this. Thank you.
Oh yeah. So you can go, like, let me give you the number. My number is 212-970-9441. You can always call for a consultation. You can speak with me. You can make an appointment. My website is www.gramercyparkintegrative.com. We're in the middle of a website upgrade, so that should be going live tomorrow. But you're always welcome to call, and we would love to, speak with you and see if we can fit your needs and work with you.
Perfect. Thank you so much. What's the phone number? Do you also have social media pages? And tell us the website one more time. Thank you.
Sure. It's on www.gramercyparkintegrative.com.
Perfect. Thank you so much for being here, for joining us and
Yes.
enlightening us on some preventative measures we should all be looking into. And thank you for sharing your own personal experience. And it's just, you just never know if it's going to be you. And this is why. This is amazing. Wow. Thank you again, and have a great day, Dr. Dladla. Thank you.
Thank you. You too. Take care.
Bye-bye.
Bye.
This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.